And in today's video, I'm going to walk you through the 8 main reasons men lose their erections during sex. And more importantly, the fast, practical, and science-backed fixes you can start using right away. Before we dive in, I'd love for you to drop a quick comment. Where are you watching from? I always enjoy seeing the community from around the world, and if you find value here, go ahead and hit like and don't forget to subscribe. That way, you won't miss future videos designed to keep men strong, healthy, and confident at every age. Now let's clear up one big myth. A lot of men believe losing an erection means you're less of a man, or that it's an unavoidable part of aging. That's simply not true. Yes, changes happen with age. Nitric oxide production drops, sensitivity decreases, and circulation isn't quite as robust as it used to be. But those changes don't mean you have to give up on intimacy. What it really means is this: your body now needs a bit more support and smarter strategies to perform the way it once did. And the great news is, once you understand why erections fade, you can take back control. For those of you who are new here, I'm Dr. Nerita, a board-certified urologist with 12 years of experience helping men protect their prostate, boost performance, and restore confidence in the bedroom. I've treated thousands of men facing these exact challenges, and I want you to hear this directly. You are not broken. You're not alone. And with the right steps, you can absolutely get this part of your life back. Stick with me until the end, because I'll not only break down the 8 key reasons erections fade, but also share practical fixes and clinical strategies that can transform your confidence. Starting tonight. Let's dive in. Reason number 1, gravity working against you. Here's something most men never consider. Your position during sex matters. When you're lying flat on your back with your partner on top, gravity actually pulls blood out of the penis instead of helping it stay in. That makes it harder to maintain firmness, especially if there's even mild venous leakage, where those tiny valves at the base don't close tightly enough to trap blood. Fix: use gravity in your favor. Positions like standing, kneeling, or having your partner face you while you're seated allow blood to flow downward into the erectile chambers, not away from them. Sometimes a simple change in angle can mean the difference between frustration and satisfaction. Reason number 2, mental distractions and performance anxiety. Your brain is the most powerful sexual organ you have, but the moment doubts creep in, am I doing this right? Will it happen again? Your sympathetic nervous system kicks on. That's your body's fight or flight response, and it directly shuts down the rest and digest system that allows erections to happen. Fix: ground yourself. Slow your breathing. Focus fully on the sensation and connection, not on the outcome. Sometimes even a lighthearted comment to your partner can break the tension. And remember, intimacy is not a performance, it's a shared experience. Reason number 3, decreased sensitivity with age. This one sneaks up on men. Over the decades, the nerve endings in the penis naturally become less sensitive. Conditions like diabetes, high blood pressure, or even just mechanical stress over time accelerate this. Less sensation means less feedback to the brain, which means less stimulation and weaker erections. Fix: there are multiple strategies. First, check your testosterone. Low levels directly blunt penile sensitivity. Second, circulation-boosting activities, like brisk walking or even short bouts of cardio, can improve blood flow to the nerves. And finally, some men benefit from external stimulation devices designed to reawaken nerve response. Think of it as physical therapy for your manhood. Reason number 4, insufficient arousal. Let's be real. Sometimes the body is there, but the mind is elsewhere. Stress from work, arguments at home, or even being distracted by the environment can prevent your brain from sending strong enough arousal signals to keep the erection going. Fix: take your time with foreplay, not just for your partner, but for yourself. Build arousal slowly, with touch, with words, with presence. When your brain is fully engaged, your body follows. Reason number 5, the self-fulfilling prophecy. Once you've lost an erection once, the fear of it happening again can cause it to happen again. This vicious cycle is something I see constantly in my practice. Fix: reframe the moment. Instead of thinking, I need to stay hard or I'll fail, tell yourself, I'm here to enjoy, connect, and share. When the pressure disappears, erections often come back naturally. And if you do lose firmness, pause, reset. Enjoy other forms of intimacy. That flexibility breaks the anxiety loop. Reason number 6, cardiovascular health issues. Remember this, erections are an early warning system for your heart. Conditions like high cholesterol, hypertension, or diabetes damage blood vessels. And the penile arteries, because they're so small, are usually the first place it shows up. In fact, erectile dysfunction often appears 3 to 5 years before a heart problem does. Fix. Prioritize your vascular health. Daily movement, heart-healthy nutrition, and supplements that support nitric oxide, like L-citrulline or pomegranate extract, can make a massive difference. Improving your circulation improves everything: your erections, your energy, your longevity. Reason number 7, hormonal imbalances, especially low testosterone. Testosterone isn't just about libido. It maintains the elasticity of penile tissue, supports nitric oxide production, and boosts overall vitality. Declining levels, which drop about 1% per year after age 30, can quietly chip away at your erections. Fix. If you suspect low T, get tested. Don't guess. For some men, lifestyle changes and specific nutrients like zinc and ashwagandha can help. Others may benefit from medical treatment. Restoring testosterone to healthy levels can reignite desire, stamina, and sensitivity. Reason number 8, lifestyle saboteurs, alcohol and timing. Here's a tough truth. Alcohol is a central nervous system depressant. Even a couple of drinks before sex can reduce firmness by up to 25%. And trying to perform right after a heavy meal, blood is busy in your gut, not your pelvis. Fix. If intimacy is on the menu, keep alcohol light or skip it altogether. And give your body at least 90 minutes after a big meal before heading to the bedroom. You'll feel the difference immediately. Now you've got the knowledge, but what's the plan? Before sex, empty your bladder. That reduces pressure on pelvic nerves. Use gravity wisely. Choose positions that let blood flow into, not out of, your penis. Engage in foreplay. Build arousal for both you and your partner. Cut back on alcohol. Your firmness will thank you. Space out ejaculation strategically. Many men over 40 find that giving the body 5 to 7 days to rebuild neurotransmitters and hormones restores stronger performance. Try a safe constriction ring. If venous leakage is an issue, these can help trap blood. Just make sure to use them properly. Support your vascular health daily. Think exercise, heart-healthy food, hydration, and clinically backed supplements. Address sensitivity head-on. That means checking testosterone, improving circulation, and even using controlled vibration therapy if needed. These are not gimmicks. These are evidence-based, practical steps I've seen transform men's lives. Now let me pause here, because if you've been dealing with this issue, you may have felt shame, even hopelessness. But please hear me, needing help in this area does not make you weak. It makes you human. I've seen men in their 50s, 60s, even 70s reclaim intimacy and confidence they thought was gone forever. And when that happens, it doesn't just change sex. It changes their self-respect, their relationships, and their overall joy in life. So here's my message for you. Your age does not define your vitality. Small, consistent changes can restore not only your performance, but also your freedom, comfort, and dignity. Don't give up. Don't stay silent, and don't settle for less than the full, confident life you deserve. If this video helped you, give it a like, drop a comment,